I'd like to welcome you to the overview of the LP3 course segment for the HA 6510 course. What I'll be doing is using the same format I've used for previous LP overviews. I'll start out by considering the assignments in the course and then turn to the LP3 course segment topics and provide you with some comments and perspectives on these topics from my point of view. With regard to the assignments, initial replies to discussion questions are due at the end of the first week of the LP3 segment as defined in the course expectations announcement. Please be sure that you review this and keep these particular timelines in mind with respect to definitions of the start and end of the first and second week of the LP3 course segment. Participation replies need to be made at the end of the second week of the LP3 course segment. All replies should be considered substantive. 2 or 3 sentence replies are not really going to suffice with regard to their being considered substantive. So in order to earn full credit, be sure that the postings are substantive, contain substantial content, and also utilize references whenever possible to support and substantiate points and perspectives. Direct quotes from references should be used sparingly, both with regard to postings and certainly with regard to the assignments. You should be paraphrasing content whenever possible. Turning now to the LP3 assignment itself, the focus here will be on writing a 5 to 6 page paper. Note that the cover page and references don't count toward the page count requirement. It should be written and properly cited using APA style. So again, I refer you to the APA 6 manual. So please be sure that you utilize appropriate format, both with regard to the content of the paper, as well as the citations contained within it. With respect to citations, this assignment requires you to use at least 3 peer-reviewed references. These should be journal-based. Web-based references alone are not sufficient to meet this particular criterion for the assignment. The assignment itself should focus on selection and research of a nonprofit or non-governmental organization which is involved in the provision of international health assistance. The following points should be discussed in the assignment: the sponsor of the agency, the services that the agency provides, the countries that the organization has served, and the impact that this organization has had on the health of citizens. You should also explore how the organizations such as the one you selected, intervene in global health concerns such as epidemics or natural disasters. And then lastly, how might the JCI impact the actions of these agencies? The due date for the assignment is the last day of the LP3 course segment, so please bear these due dates in mind. Late assignments will be subject to the penalties stipulated in the course expectations document. So please bear these particular points in mind. If you have any questions, I suggest you review the requirements for the assignment early on in the LP segment. And please let me know via email if you have any questions so that I could provide you with appropriate responses so that you can engage the assignment as early in the course segment as possible to allow you to meet the required due date. Now, turning now with regard to the topics in this particular LP segment, the key competency of focus relates to the Joint Commission on Accreditation of Healthcare Organizations and the Joint Commission International concerning, again, differences between the accreditation standards embraced by both of these particular groups. The other topics I'd like to provide you with some comments on concerning the effects of poverty on global health and also the mission of the World Health Organization. Global health considerations as well as the role of the World Health Organization, I think, will become increasingly newsworthy, certainly based on the current concerns over the Ebola outbreak that's ongoing in the African nations, as well as some of the individual cases which are being observed in the United States. So with respect to the Joint Commission International, this is one of the groups that have been providing international healthcare accreditation services to hospitals around the globe, and also brings support and revenue into the U.S.-based organization as well. This is a not-for-profit, tax-exempt private organization that is currently involved in accrediting hospitals in Asia, the Middle East, Europe, and South America. In addition, is seeking to expand its business further beyond the scopes of and boundaries of these particular geographic regions. The Joint Commission International is involved with providing a variety of different types of educational programs, which are especially what are termed practicums. And there are other accreditation organizations based in countries outside the United States which also fulfill a similar internationally oriented role, similar to that of the JCI. So it's important to be aware of these particular agencies. Part of the basis for them is to provide some level of standardization and quality seal of approval, so to speak, with regard to healthcare organizations. The JCI publishes an average fee of about $46,000 US for a full survey of the hospital. And it's important to note that reimbursement for surveyors' travel, living expenses, and accommodations are required in addition to this baseline fee. So the bottom line is there's certainly a significant expenditure of funds in order to achieve this particular type of certification by international facilities. However, the part of the rationale here is that securing this particular type of credential basically signifies to potential consumers and patients that the facility meets a certain baseline level of standard of care and quality considerations as well. What I'd like to do is turn to the Joint Commission itself and provide you with some perspectives concerning that particular organization. The Joint Commission on Accreditation of Healthcare Organizations, JCAHO, it had previously been known as the Joint Commission on Accreditation of Hospitals, or JCAH. This is a United States-based nonprofit organization which has tax-exempt status and has provided accreditation for more than 20,000 healthcare organizations and programs in the United States. Numerous, and I should say really a majority of governments, state governments, have come to recognize this type of accreditation as a condition for licensure and also as a condition for facilities being eligible to receive Medicaid reimbursements. Surveys or inspections will generally follow a triennial cycle, and these findings are made available to the public in an accreditation quality report on the Quality Check website. So this particular type of provision of certification credentials and also results of these particular types of surveys to the general public is an increasing trend in the healthcare area, and it basically provides a lot of information to potential consumers and patients, which basically makes market competition and securing certain types of credentials and certificates which basically attest to the level of quality of care provided by organizations to be of some type of value, both to the organization from a accomplishment standpoint, but also from the standpoint of a marketing tool as well. In 2008, for example, just to give you some perspective of the revenue streams that are associated with accreditation, the Joint Commission collected about $170 million in revenue, primarily from fees it charged U.S.-based healthcare organizations for evaluating their compliance with federal regulations. Expenses during that period were on the order of about $160 million. So the total return on investments in 2008 was about $27 million, and the total value of the investments was $83 million. So the Joint Commission's primary investments in 2007-2008 were in stocks and trusts. It's important to note also that the Joint Commission itself has a bit of a history associated with it and went by a variety of different names. It was renamed the Joint Commission on Accreditation of Hospitals in 1951. It wasn't until 1965 that accreditation had any real official impact. In 1965, that was the year that the federal government decided that a hospital that met Joint Commission accreditation met the Medicare conditions of participation. So that basically linked accreditation with some type of entitlement to reimbursement from different types of government programs. The Joint Commission itself is located, headquartered in the a suburb of Chicago, which is known as Oak Brook Terrace, Illinois. The Joint Commission, the predecessor organizations were really an outgrowth of efforts of a variety of groups to promote hospital reform based on outcomes management and patient care. In 1951, a new entity, the Joint Commission on Accreditation of Hospitals, was created by merging hospital standardization program with other programs that were run by the American College of Physicians, the American Medical Association, the American Hospital Association, and also the Canadian Medical Association. In 1987, the company was renamed the Joint Commission on Accreditation of Healthcare Organizations, or JCAHO, JCAHO. In 2007, the Joint Commission basically underwent a major rebranding and simplified its name to the Joint Commission overall. So this provided some level of simplification, and the rebranding itself involved the name, the logo, the tagline change to helping healthcare organizations help patients. So again, I started out by commenting a little bit on the JCI, and just to give you some historical perspective, the JCI was established in 1997 as a division of the Joint Commission resources. Through international accreditation, consultation, publications, education programs, and so on, the JCI essentially extends the Joint Commission's mission worldwide and helps to provide quality of patient care by assisting international healthcare organizations, health ministries, and others evaluate, improve, and really focus on demonstrating quality of patient care and enhancing patient safety in upwards of 60 countries. When facilities undergo a Joint Commission survey, this can be a really challenging and stressful process for any healthcare provider or any healthcare organization. At a minimum, the hospital must really be completely familiar with the current standards, examine current processes, policies, and procedures relative to standards of care in that regard, and also basically be prepared to improve any areas that aren't currently in compliance. So the hospital itself needs to be in compliance with standards for at least 4 months prior to the initial survey. And the hospital also needs to be in compliance with applicable standards during the entire period of accreditation. And this basically means that surveyors can look back for a full 3 years of implementation for several standards-related issues. So the bottom line here is that inspection and being sure that you're inspection ready isn't just a short-term type of initiative. Facilities can certainly go down that particular path, but it's much more efficient and appropriate and probably more effective for a facility to basically maintain standards on an ongoing basis, maintain awareness of processes and procedures, and stay in compliance rather than just basically square away their procedures and operations for the purposes of the inspection itself. In regard, there are a variety of individuals who serve as surveyors, and the Joint Commission and the JCI employ salaried individuals to basically fill this particular function. People generally work. These are people who have generally worked, within healthcare services. They also devote half or less of their time to the accrediting agencies. So the bottom line is they can be, you have an ongoing practice and be involved in healthcare, but they can't do it exclusively. But they will certainly have a window and a perspective into what's important and current, and actually have hands-on experience, which is useful from the standpoint of evaluating facilities. The surveys essentially travel to healthcare organizations to evaluate their operational practices and facilities against established Joint Commission standards and elements of performance. The stated goal of the Joint Commission is as follows: to continuously improve healthcare for the public in collaboration with other stakeholders, by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. This is essentially, derived from the mission statement of the Joint Commission. The company basically updates its accreditation standards and also expands patient safety goals on a yearly basis and posts them on its website for all interested parties to review. Bottom line is this is basically underscoring the transparency of the overall organization and its intention to essentially share information with both the public as well as groups that are providing health care as well. So I hope some of these thoughts have given you some perspective of the size and scope of both the missions and focus for both the JCAHO as well as the JCI in a global context. What I'd like to turn now to some comments on effects of poverty on global health, and then I'll close out this particular session with the consideration of the mission of the World Health Organization. So with respect to poverty, it's important to note that poverty and poor health worldwide are really very much intertwined and linked. The causes for poor health for millions of individuals globally are really rooted in political, social, and economic injustices. Poverty is both a cause and a consequence of poor health, and increases in poverty it basically also increases the chances of poor health being present in individuals who are afflicted by poverty. Poor health, in turn, traps communities in poverty, and that results in infectious and neglected tropical diseases, killing and weakening millions of the poorest and most vulnerable people on a global level each year. So what are some of the links that exist between poverty and poor health? Well, economic and political structures that sustain poverty and discrimination are certainly factors of relevance, and these really need to be transformed in order for poverty and poor health to be tackled effectively. Very poor and vulnerable people may have to make very harsh choices, knowingly putting their health at risk because they can't see their children go hungry, for example. There's also the cost consideration, with costs of doctor's fees, the cost of drugs and transportation to reach a health center that can be devastating both for an individual and their relatives who need to care for them or help them reach and pay for treatment. In the worst cases, burden of illness can basically mean that families sell their property, take their children out of school to earn a living, or even start basically begging in very poorly developed nations. Also, overcrowded and poor living conditions can contribute to the spread of airborne diseases such as tuberculosis and respiratory tract infections such as pneumonia. And reliance on open fires or traditional stoves can lead to a significant amount of indoor air pollution. And this, compounded by lack of food, clean water, and sanitation, can collectively result in basically a variety of different conditions which are really substandard and can also result in mortality resulting as well. So what are infectious diseases that are really some of the main killers worldwide? Certainly AIDS, diarrhea, tuberculosis, and malaria, as well as communicable respiratory diseases like pneumonia, kill a majority of people. It's important to note that diarrhea, pneumonia, and malaria account for nearly half of all deaths in children globally. There's also the issue of neglected tropical diseases affecting over 1 billion people, almost all in the poorest and most marginalized communities. Some of these diseases include leprosy, schistosomiasis, soil-transmitted worm infections, and trachoma. But they can also, these types of conditions can also result in patients experiencing severe pain and long-lasting, lifelong disabilities, and can mean enormous productivity losses, both for the community as well as on a national level for these undeveloped countries. Efforts to tackle these conditions have usually taken a backseat to some of the larger, more noteworthy conditions that are responsible for infectious diseases. So what are the most deadly non-communicable illnesses worldwide? Some of the biggest non-communicable killers are maternal and newborn deaths and deaths related to poor nutrition, cardiovascular health, and non-communicable respiratory diseases. So I hope I've done this provide you with some general perspectives concerning poverty overall and some of the conditions that are associated with it. Activists basically claim that about 10% of global health research is devoted to conditions that account for 90% of global disease burden, the so-called 1090 gap. But does this imbalance really exist, and what's really the effect of redesigning R&D systems in order to address it? These are some interesting questions overall. It's been pointed out that of about 1,400 odd drugs, new drugs that have been approved between 1975 and 1999, only about 13 were specifically indicated for a tropical disease. So that's just to give you some perspective of, I suppose, the level of R&D that's associated with diseases that oftentimes are very much in the third world country, compared to the focus on westernized types of illnesses in general. In fact, WHO acknowledges, the World Health Organization acknowledges there are only 3 diseases that are genuinely neglected: African trypanosomiasis, leishmaniasis, and Chagas disease. So a large proportion of illnesses in low-income countries are entirely avoidable or treatable with existing medicines or interventions. However, most of the disease burden in low-income countries finds its root in the consequences of poverty. And this is a direct outgrowth, essentially, of poor nutrition, indoor air pollution, and lack of access to proper sanitation and health education. WHO also estimates that diseases associated with poverty account for 45% of the disease burden in the poorest countries. So I think the point of note here is that poverty essentially has a substantial effect on the health of individuals in impoverished nations, and many of those are third world countries. And it's a complex issue, and it's also one that probably hasn't received as much attention, and certainly not as much effective attention as could be warranted in that regard. So the health problems that are really faced by some of the world's poorest populations are not really caused by lack of drugs specifically related to their problems and diseases. The real problem is infrastructure issues and ensuring that these populations can actually access vital medicines. Numerous governments fail their populations in this respect by imposing punitive tariffs and taxes on medicines, and really skewing their spending priorities in favor of defense over health. Now, the governments of poor countries hinder the creation of wealth and impose obstacles in the way of owning and transferring property, imposing unnecessary regulatory barriers on entrepreneurs and businesses, and restricting trade through without the necessary resources to access medicines that could so easily transform their quality of life. In the 1980s, the U.S. Agency for International Development funded research into a vaccine for malaria, which absorbed essentially $60 million and failed to achieve any of its goals. This failure is a really good illustration of the types of drawbacks to the public procurement of research and development funds. Because the researchers are operating to the demands of a public sector employer rather than the market, they gave out wildly optimistic statements about the progress of their work in order to basically ensure continued supply of funds. Government-funded project directors also have an incentive to fund unpromising work, illustrated by the project leader's demand for further funds, despite unpromising nature of earlier work. Finally, because the recipients of government subsidies are paid before delivery, that removes incentives to actually properly complete the research. My point in raising some of these points is that there are lots of unmet needs in this particular general area, and it's certainly an area that could basically require a good bit of additional input from a variety of different participating countries
utilizing treatment paradigms
in order to basically facilitate
is very much common
some of the
and this is because there's a lot of evidence to support certain approaches
that
being
could
utilized,
potentially optimize
and those are the
the health
approaches that are
of
utilized certainly within
world population,
and
certainly the population
within
that's
healthcare
by
organizations
poverty,
as well.
which in many respects, as I already mentioned, goes hand in hand
basically
with
evolve best
compromised
practices
health.
within medical establishments.
One of the last
And
topics
also
I
has
want
a
to
significant
move
potential
to
impact on
is the
global
mission
healthcare
of the
as well.
World Health
Since
Organization.
evidence is really the
The World
driver
Health
for the
Organization,
definition and evolution
in many
of
respects,
treatment paradigms in the
is
overall
intended
healthcare
to
market.
link together a variety of
Six
different
Sigma
areas of
basically an
focus.
approach that's
They're
been used
focused
to
on
foster
global
best
health.
practices
One of the
globally in
challenges of the
healthcare
World Health
organizations,
Organization
and
is
this
that
basically is
in many
also
respects,
reflective of the
nation-based
fact that,
healthcare provision
quality
is
is an
still
important area of focus in healthcare.
responsibility is still
Six
structured
Sigma
at
has
the
been
level of
utilized in the
individual
manufacturing
countries.
industry
So the
for
intention
quite
here
some
is,
time.
in some respects,
However, it's recently
a
making
coalition
its
of
way
sorts.
into healthcare
The issue, though,
organizations
is
as
it
well.
doesn't really have
And the point I want to leave you with here
a
essentially is that
true
quality and
political
evidence-based
clout
medicine are
within
two key
individual
areas of
countries,
focus in healthcare.
and their
And
scope
these
of
two areas
operation
will
is, in
probably
some
do a lot
respects,
to transform
constrained by
how medicine is
budgetary
practiced and
limitations
healthcare is
as
administered.
well as
And
geographic
there'll always be
boundaries.
an ongoing driver to basically
Obviously, if the
close the
countries
gap
are willing to
optimize the
partner with the
quality
World
of
Health
care in
Organization,
order to
there's a lot of
optimize outcomes.
benefits that can be
And that's intended
provided
for
to
two particular
participating
reasons.
countries.
One is
However,
there's a
in many
clear benefit to
respects,
the
this
patient.
requires much
But
more
the
of a
other aspect
partnership,
is if you can
and
optimize care and
alone,
outcomes,
without some
you
type of
also,
collaboration and cooperation, World
do a
Health
fair amount to
Organization
contribute to
really
mitigating
can't necessarily
the
cross a
issue
national
of
boundary
healthcare utilization rates and
without
decreasing them.
the
And that overall
invitation and
factors
cooperation of the
into
participating countries.
cost reduction as an overarching theme as well. So I think quality, evidence, and focus on cost reduction in healthcare.
So who, if you look at the website with respect to
the
who,
United States,
you'll see that
and,
it's
also globally
basically
as well. So
you
appreciate your attention.
focused on
Please let me know
directing
if you
and
have any
coordinating
questions
authority
as we
for
move
health
forward with
within the
evolving,
United Nations system.
content for
So my
the
earlier
final
comments
assignment.
concerning this particular point
Thank you again.
certainly factor in to be of relevance here, because it's providing leadership on issues relating to global health, shaping health research agendas, and basically providing technical support to countries in monitoring and assessing health trends. The role of the World Health Organization is becoming increasingly prominent, particularly as local issues which had previously been affecting countries in the past have taken on much more of a global type of ramification and have global implications. I think a great example of this is certainly the current challenges that are facing a variety of nations relating to Ebola. And again, the intention here is to have some type of collaborative effort internationally in order to basically maintain vigilance of index cases and contain the spread of this particular condition. hopefully the efforts of a
and
variety
these
of
include
nations in
peer-reviewed
accomplishing
references.
this,
And again,
as well as our own here in the United States, will be
journal-based,
successful.
web-based
But again,
references
it,
if
it
you're not
takes
linking to a,
cooperation
journal
and
would not be considered
some level of collaboration as well in order to really optimize
The assignment
global
itself
health.
should focus on
And this is certainly
analysis
one
and
area of focus
evaluation
with
of the
respect
impact
to
of health
the mission of the
education
World Health
that's provided by
Organization,
relief
but
and,
that doesn't necessarily
non-governmental
mean that
organizations
individual
and
countries are not
countries,
actively involved
which are
in some
undeveloped.
types of the same types of
Consider,
initiatives, which
following
are becoming
four
increasingly
areas of
global in
focus,
terms of
when
their
you're
scope.
compiling content.
Thanks very much for your attention.
How the issues
And I
we've
look
talked
forward to
about
working
so
with
far
you in the
have
LP3
impacted these
segment.
types
If
of
you have any
initiatives,
questions,
what
please
the
let me
major
know,
initiatives conducted
and I'd
by
be happy
those
to try to
agencies
clarify
are,
them. Thanks
how
again for your
effective they've
attention.
been, and how these organizations impact U.S. health. My suggestion as you evolve content for the paper is to consider breaking down the paper into individual sections that will better allow the reader to focus on the points that you're going to consider. Start out the paper with an overall introduction defining the topics that you'll consider. Consider these particular 4 points, and I think from again a structure standpoint, I'd have sections that are devoted to each of these particular points. And then be sure to include a conclusion section or summary section that ties the information together for the reader. The due date for this particular assignment is the last day of the LP4 course segment.